Hi, I'm Paul the Physical Therapist and welcome to my vlog. Today I'd like to talk with you about Cedar Hill Physical Therapy's telehealth offerings. When the pandemic started, there weren't clear guidelines on how to prevent the spread of COVID-19 and there were shortages of personal protective equipment or PPE. Therefore, we closed our office to in-person treatment and began offering telehealth. While we've been able to reopen our clinic to in-person treatment by using masking, social distancing, and enhanced sanitization, we've seen a continued interest in telehealth. This has been for 3 reasons. 1. There are some people who wish to minimize their risk of exposure to the virus. Frankly, I think that's a smart move. 2. Busy people like the convenience of virtual visits from their home or office with no wasted time on transportation. 3. We've had some people who live in other parts of North Carolina who know the quality of service that we offer. They are using telehealth as it allows them to choose their own healthcare provider. What should you expect from physical therapy offered via telehealth? Firstly, you should expect to learn how to move better and feel better. Honestly, when I first started doing telehealth, I was unsure of how well it would work. I have gone on to provide over 100 telehealth visits with the majority of people responding remarkably well. In fact, I've worked with people who didn't improve in a previous course of in-person physical therapy with other providers who got better with me via telehealth. Why is that? Well, what do you think is the most beneficial thing that a physical therapist can do to help you to move better and feel better? The answer to that question is education. For everyone that I work with, my main goal is to teach them what they can do to improve their condition. I may see a person for 1 or 2 hours a week. That leaves up to 167 hours per week for them to utilize what they've learned to get better. This is a hallmark of the McKenzie method, of which I am a diploma. Some reasonable questions you might have are: 1. Don't you need to put your hands on a patient to determine their physical therapy diagnosis? And 2, don't you need to do something to the patient to fix their problem? The short answer to both of these questions is no. Sir William Morsler was a British physician from the late 1800s who is famously quoted as saying, "Listen to your patient, they are telling you the diagnosis." The most important information about a person's condition is gleaned from giving them ample time to tell their story. Understanding how their pain came about, how it behaves, and how it affects their life is a big part of finding a solution to their problem. From there, in short, a patient can demonstrate their problem. For example, a person with a painful hip may not be able to cross one ankle over the other knee, or a person with a painful shoulder may not be able to touch the top of their head. We call that demonstration a baseline. Via telehealth, a person can be instructed to test out different exercises and to see how these exercises affect their baseline. When we find an exercise that allows them to move better, we recommend they continue with it. If I try to fix a person's problem for them, they may obtain short-term relief of their symptoms. If I teach them how to fix it themselves, they can see real long-term improvement. Now, do I see telehealth replacing in-person physical therapy? No. There are some patients who benefit from a more hands-on type of approach, or they may benefit from using a particular piece of exercise equipment that we have available in our clinic. In some cases, a patient may benefit from a combination of in-clinic and telehealth visits. I see telehealth as a very good option. I'm Paul, the physical therapist. If back, neck, or extremity pain stops you from doing the things you enjoy, I can help get you moving better and feeling better. My clinic, Cedar Hill Physical Therapy, is located in Summerfield, North Carolina, just outside of Greensboro. I am available via telehealth at doxy.me/Paul the Physical Therapist. Telehealth is available to people who are currently in the state of North Carolina and people in other states that are part of the Physical Therapy Licensure Compact. Thanks for watching. We'll see you next time.